Today, I will be telling you about three nations, their healthcare systems, and how they react and treat lung cancer and its root cause, or its most popular cause of smoking. The three countries I will be talking about are Argentina, the United States, and France. Argentina is the only developing country considered by the UN, or excuse me, the only developing country that I will be speaking on. It has a population of around 46 million people. It is divided into 24 provinces, and around 70% of that live in urban areas in the sixth most prominent, in the sixth most urban provinces. It has a mixed economy, or a mixed healthcare system with, excuse me, with around 36% of the people being covered by government funding, 13% paying for private, and 60% of it being covered by Social Security. The biggest issue facing Argentina is it's still developing. Their physicians can't always work with each other, and, lack of access in rural areas. In the United States, they have a somewhat similar system, except only 92% of them are insured. Around 50% of that is insurance through the employee or employer. Around 36% is Medicaid or Medicare, the government, and around 6% is market-based health insurance. The United States also, as well, sees a lack of access to healthcare in rural areas. Our third country, France, the second developed country I will speak on, has a compulsory financed system. So it's run by the government and financed mostly through taxes on profits. The hospitals can be publicly run, privately run, or publicly or privately run, nonprofit or for-profit. Most employees do not work for the state, they work for their hospital. And one big issue that they face is workforce issues. The largest risk factor for lung cancer is smoking. Around 80% of lung cancer deaths are somewhat associated with smoking, and when you smoke, you are 15 times more likely to get lung cancer or to die of it. Argentina, whose president is placed there, is ranked 54th in smoking by percentage of population. 21.9% of the population smokes, and due to a lack of oncologists and physicians, they can't always work together because there's not that access in that developing country. In the United States, approximately 22.1% of the population smokes, putting them at 52nd in the world at population percentage smoking. They have 127,653 deaths due to lung cancer in 2022, which is a rate of 16.6 deaths per 100,000. They have cigarette taxes enforced statewide, and they have popular nationwide anti-smoking campaigns. In France, approximately 24% of the population are daily smokers, putting them at 24th in smoking percentage. They're ranked 8th in new cases of lung cancer and have a worse incidence than the United States at 35.9 per 100,000 and more deaths per 100,000 at 24.2. They still allow tobacco advertising. They do not have a ban on it advertising to specific areas, and they do not have a countrywide protocol for their whole healthcare system for screening for lung cancer, as they believe that CT scans give them false positives. In the screening, we see about the same screening between France and Argentina, except in France, it's because they don't believe that it's efficient, and in Argentina, it's because they don't believe, or they don't have access to as much screening and testing. I'm sorry. Also, Argentina does not have the ability for their physicians to work together always, and they lack some medical boards to decide about patients and what they should do with a patient based on his case. Lastly, at the healthcare system level, they need to focus more
on providing access or not providing access, because that is largely an issue that affects Argentina specifically. They need to push and push for more scanning, and they need to push for more public campaigns against smoking. Cigarette taxes are something that I can't speak on. That's depending upon them, but they need to push for more screening.